So this is how we do the bilateral simultaneous cataract extractions at premium vision. You can see this glass room in the back, this separate room with separate ventilation to prepare the trays for the day. So while we're doing one eye, the nurse already prepared the second patient's eyes. So there's two tables in there. So when the nurse comes early, she'll prepare four tables. So we have the first tables for the first patient, the bilateral, and then we have the two tables for the second patient. And this way we always have ready tables so that when the nurse have time, we'll prepare the next one to be able to not to have wasted time in between to prepare the tables. And this room saved me a lot of time. We are able to do about 5 cataracts per hour that way. So we're done one eye, so we'll switch it to the other side. We have this nice chair that has the platform, so the foot switches are already on the platform. So everything goes really quick. I'm verifying the lens, power, expiry date, and the central colony thickness, and the white diameter, which is important for the wound construction. So we're doing the second eye for that patient. The two tables for the next patient are already ready. So once this patient is done, we'll move the patients out and get the new tables in and the new patient in. So we're all set, so not to waste any minute in between. So I have 2 scrubs and a circulator, and the circulator also does the day surgery. So everybody knows the rules and the roles of that other person, so they all have to share these responsibilities. Whoever have time, they will do something for the other nurse would need to do. So now we're done the first patient. You can see we started the second patient, and the tables from the first patient are now in the glass room and being prepared for the third patient. So this way there's no wasted minute. So we start with the right eye always, and then end up with the left side, for example. So the second patient will start in the left side, and then we'll go for the right side. So we always arrange that the day that way. And some patients will want to start with one eye more than the other, so I'll arrange the day that way. So I'll start on the right eye or left side, depending on what we need and the situation of the eyes. So I usually start with the easier eye. The more difficult eye is more possible to get complicated, so I can leave it to the end. So we're doing the second eye of the second patient, while the table is being set for the third patient. So this patient is done, is out, and now the new tables are out of the glass room. The old tables are into the glass room. They already have been cleaned, and we're setting up for the third patient. So once the third patient will come in, we will start on the eye we ended up with. So we ended up with the right eye. So we'll start on the right eye for this patient. And once we're done, we switch to the left side, have a new complete setup. And the nurse, when we're doing one eye, she doesn't touch anything that we touch from that eye. And she can go actually to the table in the second eye because she didn't touch anything from the first eye. She can set up more on the left side, on the other eye, and she can come back to finish this surgery. Now we can see the second scrub came in and is preparing the second table for the second eye. So once we're done, the table is already set up and we're ready to roll. So this way it's not a wasted minute. So this is the first eye, left eye of the third patient. I lost track actually. I can't remember which eye is it. Okay, actually this eye, this is the second eye of the third patient. Because now we have 2 tables inside and 1 table outside on the left side of the screen. And this is Troy finishing up this surgery. And we're done. Patient goes out. And the new tables comes in. And the new patient comes in. So we end up on the left side. So we're gonna start on the left side of the next patient. So okay, cleaning, setting up. So we're starting on the left side of this patient. And review the lens. Again, same thing. Review everything. This is a pause that we have to do to verify all the details of the lenses, the decision making, and calculations, and white-to-white diameter, which is important for the if the white-to-white diameter is too small, you can actually, when you implant the lens, if you push hard, it can open the capsule because the eye is small. So that's why we make sure that we don't get into this mistake. And the cornea thickness is important for the wound construction. So the thinner the cornea, the more angulation we need to reach the 2 millimeter deep incision that way. So we're starting this is the second eye of the fourth patient. And again, you can see the tables being prepared inside the glass room, getting ready for the next one. So this way there's noticing a moment, and in between the patients, I would go to the exam rooms and examine the patient that we did already. So those patients, when they're done, they wait a little, and then they actually get examined for the post-op. It checks the vision pressure, and then they can go, and they don't have to come second day most of the time, unless there's something that we need to check out. So this way, even for their efficiency, is that the patient doesn't have to come second day. It's always do it the same day. Okay, again, we're starting on the eye we ended up on. That's the right eye. So starting the right eye, verifying the lens again. So you notice that the scrub was circulating. Both scrubs can circulate. All the nurses can scrub, and all the nurses can circulate. This way, we're very efficient that way. So once we're doing the first eye of this patient, the second table is already set up, and once we're coming close to the time we are ending up, so the nurse actually scrubbed and getting this table ready, and we're getting ready for the second eye, the last eye of this patient. And the day goes along, and you can see that the immediate sequential bilateral cataract surgery is very efficient in time-wise. And this way you can do a lot of patients in a short period of time. They can cut the waiting list, decrease cost by decreasing the labor time wasted, the war time wasted. So you can see the scrub nurse is preparing the two tables for the second one in the glass room. And once we're done with this one, comes out the same thing. You get the idea. So this is the idea. So we're done with that. I hope you enjoyed this video. And you can just know how to do the bilateral simultaneous cataract extraction, the practical way to how to do it.